everyone. My name is Lou. So today I'll be talking a little bit about cervical cancer, what it is, diagnostic testing, procedures, and any symptoms. So cervical cancer, starting with the word cervical, if we break that down, the suffix all means pertaining to, and the combining form cervical means neck or cervix uteri. In this case, we are talking about the cervix uteri, so cervical means pertaining to the cervix uteri. So what is cervical cancer? Cervical cancer stems from the uterine cervix. Therefore, it is only in females. It's strongly associated with human papillomavirus infection, or HPV for short, and it can be asymptomatic or symptomatic. And there's two common types. There's the squamous cell carcinoma and adenocarcinoma. And then there's other types like adenosquamous carcinoma, small cell carcinoma, and the list goes on and on. And as I mentioned before, there's two common types of cervical cancer. And so just a little bit about them. I don't want to go too much into detail, but squamous cell carcinoma, it stems from the cells that actually cover the outside of the cervix. And it can be keratinizing versus non-keratinizing. And the only difference is that one can be like a keratinized mass and the other one is not. And then adenocarcinoma, it stems from the inside of the cervix. And two common types of that would be the mucinous adenocarcinoma, which is the most common type, and then the endometrioid adenocarcinoma. So for signs and symptoms, like I said earlier, it can be asymptomatic, or you can have symptoms. And some of those symptoms can be vaginal bleeding between cycles, so menstrual cycles, postcoital bleeding, meaning bleeding after intercourse or even during, contact bleeding, meaning there's bleeding from the cervix when a pap smear is being done, or any form of vaginal inspection. Or we can also have a foul smelling vaginal discharge and dyspareunia, meaning painful intercourse. So those are a small list of the extensive list of symptoms that females can experience. And so screening tests for this would be getting a routine pap smear or a Papa-Nicolau test. And what this is, it's samples that are taken from the uterine cervix, and they are analyzed under a microscope to see if there are any abnormal cells. And so during a pap smear, if you're over the age of 30 or otherwise indicated, you can add and include HPV testing to further analyze the cytology. Speaking of cytology, there's ways to grade, and depending on what grade you have, a different treatment will be obtained. And so if you have a normal PAP, you don't have to worry about it for another 3 to 5 years. But if you do have something called atypical squamous cells of undetermined significance, or ASCIS for short, sorry, this is one of the lowest grades of cytology that there is. And so if you have ASCIS with negative HPV testing, then you just repeat your pap smear in 1 year. And what this means is just there's some abnormal cells that they visualize, but they cannot determine if they're worrisome or not, which is why you repeat it in 1 year. But if you have ASCIS and HPV positive testing, then you will have to repeat your PAP in 1 year if you are the age of 30 or younger, or 29 and younger. But if you are 30 and older and you had that ASCIS and HPV positive testing, then you would need a colposcopy. And as you go up in the grading, we've reached low-grade intraepithelial lesion, or LSIL for short. And so this, if a patient is 21 through 24 years old, a pap smear will need to be obtained in 1 year. If the patient is 25 years or older, a colposcopy will be done. And if the patient has LSIL and they were positive for HPV, a colposcopy is called for no matter what your age range is. And then we go into atypical squamous cells cannot rule out high-grade intraepithelial lesion, or ASCH for short. Whether or not you tested positive for HPV, it's automatically a colposcopy, and the same thing applies for high-grade intraepithelial lesion, or HSIL for short. It's an automatic colposcopy. So moving on, if there is any abnormalities, I did mention that there was a colposcopy that gets done. So a colposcopy, if we break that down, the suffix scopy means visual examination, and the combining form colpal means vagina. So basically, this is a visual examination of the vagina and the cervix, actually, using a lighted microscope or a colposcope. And so this is done again when the cytology is suggestive of precancer cells, or if there's any symptoms like the postcoital bleeding or the contact bleeding. And the colposcopy, the procedure it can be pretty quick. It's prepped using acetic acid, and then it's stained using Lugos, or it's a Lugos iodine solution, to see if there's any cervical cell changes that can be seen under the colposcope. And so whether there are any changes that light up to the gynecologist, they will determine if any biopsies or endocervical curettings can be taken at that time. And so if there's any abnormalities with a colposcopy, then a loop procedure or a LEEP procedure is done. And this is a loop electrocervical excision procedure. And so basically what happens is that there's a wired loop that is heated with an electric current. And depending on the biopsies from the colposcopy, they'll be able to excise tissue from those sites. And this can lead to shortening of the cervix. And I did mention about the colposcopy results, so going back a little bit, if the colposcopy comes back with no dysplasia or it's negative, you just repeat the PAP in either 6 months to a year, depending on what your gynecologist recommends. And then if there is CIN1, which means CIN means cervical intraepithelial neoplasm. So if there is CIN1, which means mild dysplasia, you repeat the PAP in 6 months. If there is CIN2, meaning moderate dysplasia, your gynecologist will most likely want a LEEP to be done. And then if it is CIN3, severe dysplasia or carcinoma in situ, they will either do a LEEP to try to remove as much of the tissue as possible, and then depending if the margins are clear, then it should be fine. But if margins are not cleared upon histology report, then you might need a hysterectomy. Therefore, definitive treatment would be considered a total hysterectomy. This should clear all of the cervical cancer cells. And then depending on your gynecologist, if they feel comfortable with it, it is recommended that they do vaginal PAPs, meaning they take cells from the vaginal tissue to evaluate any cell changes within the vaginal cuff that can be affected from any like leftover cervical cells. With that being said, this is the end of my presentation, and I appreciate you all for listening. I really hope that this has helped you understand a little bit more about cervical cancer and how we can screen to prevent cervical cancer, from further developing. Thank you.